on.
We educate and create awareness about leukemia and blood cancers. And especially our big aim is to encourage the BME people to register to become potential stem cell donors and also to give blood, because we realize that if you're Black and you are unfortunate to get diagnosed by leukemia, you got next to none or about 2% chance of getting a bone marrow donor. But also we recognize that people don't register because they are either not aware of the process, they're not aware or well educated about leukemia, they are not aware of treatment processes. So we took it upon ourselves to make sure that, because we know knowledge is power, that if we give people knowledge about leukemia, then obviously then that will encourage them to be able to register to become stem cell donors.
So thank you very much. I just wanted to share that. That is what we do. We encourage BME people to register to become stem cell donors, because there are very few people of us, of our color, in the bone marrow register. So we, as I said, we have been holding these sessions because, as you know, cancer is not, we deal with very serious illnesses like cancer, and especially leukemia. As you all know, leukemia is one of the serious blood cancers. There are so many other blood cancers. We also cover sickle cell, and actually also all other cancers, because we realize that cancer is a dangerous disease. And obviously, as you all know, I don't think there is a family who have not experienced cancer in one way or another, through friendships, through family, maybe even through personal experience. So we thought that even though we encourage people to register to become stem cell donors, we also realize that people go through really, really difficult times, especially in dealing with their emotional well-being, in their mental well-being, and especially when you're diagnosed with such a serious illness, it really becomes a big shock. You find it very difficult to cope, and really because of having that difficultness to cope, it compounds the illness and makes things even more difficult. So we thought it is good to create a safe place where people actually can discuss about their experiences, their feelings, their emotional struggles, and also how they coped and how they, what kind of skills that they used to be able to help them get along with the illness and the difficulties that come up with it. So I do know it's a sensitive subject. It's especially when we fear facing the disease with all it brings into our lives. So people are afraid to discuss some of these things. People are afraid to face some of the fears that comes with it. And I mean, so many other things. And also, especially the family members, they also struggle with a lot of questions, with a lot of doubts, with a lot of fears, and they're not sharing it with anyone, and they're keeping quiet with it. And again, there are so many things that happens when we are experiencing this kind of difficult journey, because then you have, we all need support systems, and sometimes the support systems can be very, very helpful, very powerful, and very good. And sometimes we have friends or even family that sometimes cannot be very helpful, not because they don't want to be helpful, but because they don't know how to support people who are undergoing the illness. They really don't know, and they don't know what to say. Sometimes they say the wrong things. Sometimes they do the wrong things. So this forum is really a safe place for us to discuss, to share our personal experiences. I know within the group here, we have people who have recovered from the illness, who are on the journey. And we also have families here who also have had a loved one who have undergone through that illness. And actually, I like talking about myself because for me to be able to sit here and talk about it, I'm just not talking about it from ignorance, from a point of ignorance. I'm talking from a point of personal experience. And when I say personal experience, it is something I went through. I struggled with it. And I wish I had a forum like this where I could have shared with the people what I was going through. It was a very lonely journey. And I also know what helped at the time. I know what didn't help. And I like sharing what made me maybe, get through it all, because there is always they say there is always a light at the end of the tunnel. So I remember what I was going through and the difficulties I was experiencing. And I only wish I had somebody to talk to share with, and to need it to bear my feelings to them. Because sometimes people don't sometimes have enough money to go and see a therapist. But when you talk to people who are going through the same thing, you can really find a lot of relief. So I don't want to keep on talking, but I want to invite Isabel, and also, and after that, maybe Jane Kemaru, just to talk briefly about what we are about and the sessions that we've been having, and how we can all benefit from this discussion. Then after that, I think we are going to open the floor, people asking questions, people sharing their experiences, all their stories, and especially sharing their coping skills and what helped and what did not help. What was powerful or not powerful, or what through your journey, what did you experience, and what would you advise someone? So it's really about those things that we're going to talk about today. But before that, let's have Isabel. Isabel, are you there?
Hi, how are you? Thank you so much, Veronica, for that introduction. I'm called Isabel, and I also prefer to call myself Gathoni Muigai. I'm from Kenya, and I'm a mental health nurse working in the UK. I'm also I've experienced cancer in a very personal way, because my dad suffered with prostate cancer for about 4 or 5 years, which eventually he succumbed to it and passed away. And I have walked that journey of seeing the diagnosis, the shock, not understanding how to deal with it, being away from home, living in the UK and parents in Kenya, and not being there. And the anxiety, I think what we've been speaking about before was the anxiety and the stress of dealing with the whole experience, and the pressure, especially when you're in the diaspora, when you have to provide, when people are looking at you back home and saying, send money home, we need treatment, we need help. And even for those who are here, the stress and the anxiety that it causes for your own mental well-being. We know that mental health does not discriminate. Any of us can catch it. And we say that mental health is as common as common cold. So just like COVID has been going around and it's been very common, that's the same thing. And post-pandemic, people are struggling with a lot of the isolation, the trauma, the pain they went through. And when you're suffering from cancer, or when your loved one is going through that experience, it causes a lot of pressure, not just on the patient, but on the whole family and the extended family. So when we look at the life in the diaspora about our mental well-being, we know that our people from BAME background are not very keen. There's some stigma about seeking mental health support. So when you're coming from the BAME background, it is kind of not normal for us to go and speak to a counselor. It's not normal for you to say, I am struggling. We are not very good at calling the emotion that you're going through by its name. You're not good at saying, I'm feeling quite overwhelmed, I'm feeling quite stressed. It is making me feel very anxious, it's causing me to feel depressed, I'm feeling that I cannot cope. And remember that on top of the other things we are struggling with is the issues of immigration sometimes, family, and there's a lot of things you're going through. We know some of our family members in diaspora, they've left their children back home. So as a person living in the diaspora, whether you're suffering from cancer or not, or you're experiencing someone with a family member with cancer or not, you're already subjected to so much pressure and mental health and emotional roller coaster that we all need to be having a counselor on the side. They say that people who the most successful people in the world, they have their own psychologists, they have their own managers, they have people looking after their emotional and mental well-being. And as people from BAME background, we are so busy trying to catch up and find resources that we neglect that element because of also the stigma. So when you look at someone who is, when people come into mental health services, it is just like the way if you broke your leg and you went to A&E and you had a cast put on your leg, it is the same thing. There's no difference between me as Gathoni, my physical health and my mental well-being. They are one and the same. They're affecting me as a person. So there's no shame in taking 6 weeks out and saying, just like my leg would take 6 weeks to heal if it's fractured, I need 6 weeks out to get well in my mental well-being. So when you are within the system of the UK, where sometimes you're too busy. We have a fantastic Kenyan community. For those who come from Kenyan community, the spirit of Harambee, spirit of togetherness, we look after each other. So there will be moments sometimes when you be on your own, struggling and trying to understand, how do I manage the day-to-day finances? How do I get someone to do some shopping between the next visit I get from a relative or a friend? So, and as my expertise in the role that I do as a mental health nurse, I work in a role called a care coordinator. A care coordinator is someone who looks at someone's holistic needs, from health and social needs. So that would include looking at housing, looking at benefits, looking at all the needs that you need to help you, to take that stress away from you, to help you get better. One of the things we spoke about last time is about financial support. We know that because we are used to working, most of us don't even understand how the benefit system works in this country. And the benefit system is like another language altogether. If you've never been in it, some of the forms that are being given to you, you cannot even understand how to complete them. I'll give an example of when I was talking to a friend, and I was talking about when you're completing your benefits form, your ESA, your universal credit, your PI, personal independent payments. If that form is asking, can you feed yourself, and you're going through a period of treatment for cancer, your immunity is so compromised, your energy levels are so low, you have no motivation to get out of bed and times go for shopping or get something. You're not able to stand for 10 minutes to prepare a meal for yourself. So if that form is being asked, can you feed yourself? It doesn't mean whether you can take a spoon from your plate to your mouth. That is not feeding. That means putting food in your mouth. But feeding yourself is a process. It's a process of saying, have you got money in the bank? Have you got the energy to go to the shops to be shopping? Are you able to bring your shopping wherever you live upstairs? Or, are you able to stand at the kitchen and prepare your meal for 20, 30 minutes? Are you able now to store your food? That is a process. That is what feeding is. Feeding is not just saying, I put food in my mouth. And sometimes if you don't have the social support, then it's very difficult for you to feed yourself. It's very difficult if you're not eating well to get better. And understanding the forms that needs to be completed and using the right language so that you can complete that form appropriately to get the right help is very crucial, because if you are awarded the benefits that you need or awarded the right housing, if you're awarded all the right support systems that you need because of the way you complete the application forms, then it means you're going to get better. And that's why, as people from BAME background, we are so many professionals who have wide experience in so many areas that when we come together, we can provide that professional support to do the paperwork that is needed. Someone can come and prepare food. I can come with a meal, we sit together, have a coffee while I'm completing all the forms that you need. And that takes away the stress and the pressure of feeling that you're not coping, you're not managing your bills, you're not managing your dietary needs. And it is so interesting that, we have all these skills and we need to bring our people together and say, we have a hub of skills sets that we can share to help people in our community who are struggling with cancer or any kind of severe illness, to support them, to say, we can do this part for you, you concentrate on getting better. So, and if you're taking that help from somebody else, then you're not feeling stressed, you're not feeling overwhelmed, you have time to sleep better, you have time to say, yes, that's done, I've ticked that box and that's done. Then you're more at peace. And when you're at peace, your body is relaxed, you sleep better, you recover better, and you feel the things, you're on top of things. Mental health is really a wide topic. There's so much you can speak about, but I'm here to just say the help is out there. Let us look after each other. Let's look after our emotional and mental well-being. Having a loved one back home and you are trying to do a shift and your mom is in hospital and you have to still provide for your children, provide for the finances back home. It's a killer. Emotionally, it will kill you. You're at risk of feeling so depressed as some people who go through long-standing depression without getting treatment, they're at risk of developing psychotic depression. So you're at risk of having what we call a breakdown, developing psychotic symptoms. And if you can just tap onto your friend and say, Veronica, there's this, do you know anybody who can provide that emotional support? I'm feeling so overwhelmed. Then within our set of professional networks, we can say, BAME backgrounds, and say, you can speak to that person. That person will maintain confidentiality. We will not share what is going on with you, but we will stand with you when you're going through the most difficult time as part of us giving back. Because as a BAME background, what we're good at is giving back, being there for each other, coming from an amazing community, amazing culture back home of saying the spirit of togetherness. So let us not be ashamed. Let's not be embarrassed for seeking help, because we are here to stand with you. Because today it's me. I've been through that journey. We've gone through a journey where my father-in-law had COVID, and it was such a difficult journey. Some people held my hand. As a mental health, I'm not immune from developing mental illness as well. I'm not immune from feeling overwhelmed, depressed, and stuff like that. But if someone can hold my hand, I'll be able to hold somebody else's hand. I don't want to speak too much because I can speak a lot, but I want to thank you all for coming. Let us walk in this journey. Let's look after our mental well-being, and let's seek help, because there is so much help out there from our BAME community. Thank you so much.
Thank you so much, Isabel. That was wonderful. That was wonderful. You touched on things that I haven't even been able to touch. And that's why it's good for people to combine their efforts and their skills and their experiences together, so that we can really help our people, because we do know where the problems are. We do know what the issues are. And I always tell people that even though, as you say, you have said something very important, that even though you're a mental health practitioner, you are not immune to getting depressed. And I can tell you, I was a full, not only a practitioner, I'm a therapist. And believe me, when my son was in hospital, I was depressed. And I tell people, I would wake up in the morning and the whole thing would hit me so hard that my son is in hospital, the uncertainty of it all, not knowing what's going to happen to him, not knowing what tomorrow holds, always waiting for that call that somewhere in my mind, I thought I'll get that call. And you know what that means? That fear would paralyze me in the morning, and I would feel like I don't want to wake up. I don't want to do anything. I don't want to go anywhere. And sometimes what would get me out of bed is the same son thinking that if I don't go to see him, who will go to see him? Because I felt I was the only one who was able to give him that love and that support. So when we talk, when we bring people to talk about these things, about emotional support and health, I am coming from a personal experience where even as a therapist, that I experience the same thing. I actually tell people I never thought I would be on the other side of the table, being the one who is being asked by the GP, are you depressed? And because I was always looking after, or I always look after people who are actually going through depression. So it is very important, because when we talk about cancer and the experiences that come with cancer, you have also mentioned something that even when as diaspora, when our families back home have this cancer or anything, you are carrying so much. You have to work, you have to look after your children, they want money back there, and also you want to see them and help them, and the whole thing can really make you depressed, to be honest. So depression comes in so many ways, in so many forms, to all of us, and it is not a shame to talk about it. It is not a shame to express what you're feeling, and that's why we are having this space where we know people who undergo this kind of serious illness. We can use this space to talk about our experiences, share it, and help one another. So thank you so much for that. And I'll also now welcome Jane Kimaru. She is a cancer specialist, and she works in I think in Royal Marsden. But I want her to talk to us about her experiences, because when you're exposed to seeing people go through the system, what do you see? What can you share with our audience today, Jane, in terms of your work and experiences?
Good evening, everyone. My name is Jane Kimaru, and I work in a cancer hospital, which I've been doing for the past 9 years. And my passion with cancer just came because, as Gathoni has said, it's a personal journey. When my mom developed ovarian cancer back in 2009. And I just didn't believe that this was something that would happen to me. And this is something that really put me in the deepest pit that I can never, ever, ever tell. I couldn't ever get out. I never thought that I would ever get out of it. But I think the best part of it is that I got out of it, and knowing what I knew and knowing that my mom was affected was even worse, because I knew what was coming. And I think that is what was killing me every day, because I knew what was coming, I knew what was happening, I knew what had happened to her. But the thing is, dealing with her and trying to convince her that she's going to get better was even more difficult. And me as a healthcare provider as well, trying to provide for the patients and trying to provide financially for my parents back home was as well a difficult situation. And that time I wasn't even thinking about myself. I neglected myself. I neglected my family because I just couldn't. The only thing that I was saying is that my mom was going to get better and I needed to provide the treatment that she needed. Unfortunately, she passed away in 2009. Fast forward, story of Kevin came up, and I didn't know Veronica as well. And I knew her through Gathoni, who was the first speaker. He's a very good friend of mine as well. We were classmates in university. That's where we met. And she said there's this lady whose son who has got leukemia, and you guys, can you be able to go and support her? And because I don't live too far from her, I went. And actually the day I went to visit Kevin, Veronica was in there. So we went there, we stayed with Kevin. She came towards the end, and the journey started there. So unfortunately, as much as we tried to fundraise, not fundraise, actually create awareness to try and save Kevin, Kevin passed away. So that is how Kevin Karao Leukemia Trust was born. And I am very, very passionate about it. Reason being that coming from a BEM community, coming from the Black and ethnic minority, we experience so much unknown when it came to these blood cancers. People could not, when you were even going to ask somebody to register, people didn't know. Everyone, they're like, no, I can't, because I think they're going to take my bone marrow. And it's trying to convince. And I think, unfortunately, through our culture, there's a lot of myths that haven't been broken. And this is the problem we're facing even today. We're still struggling to convince people. And when we go for this, even like awareness drives, it really breaks my heart to believe that I'm trying to convince somebody something that I know very well, something that even my daughter had gone through, because she matched a child, I think it was in America, and had to have her stem cells harvested. And no one can be able to understand. But all I can say is that unless you walk through that journey, unless you have been through it, or unless you know somebody who has been through it, you wouldn't understand what it means. I always say cancer is not sold in supermarket. Cancer is not something that you go and choose and say, this is what I want to have. And I think we all have this fear of being known that we are struggling. And like even my mom, most probably maybe she didn't want other people to know that she's going through this. And I think it's sometimes become a very personal journey. And why? Because mentally, you don't want to be known you're unwell. You don't want to, we're in a world that everybody wants to be seen as if they're well. It needs to be seen that they're not struggling mentally. Everyone doesn't want to accept that they've got mental problems. And I think until we come to a point of we are open to these conversations, we are going to have open and honest conversations, it's going to be difficult to be able to penetrate into the bubble. So I know I've spoken about so many things because I've got so much in my head. And coming to what I normally do, I work in diagnostics. And when I mean that I work in diagnostics, I see patients who normally would come with a symptom and then most probably have a diagnosis. And you're seeing people coming through a very difficult journey. You've come naively, not knowing, and most probably coming out of there with this burden of a disease. And it's with the sessions that we have had before, we have had different things that we have discussed. We have discussed things like pain. And, you know, when you come and you have a diagnosis, you've got emotional pain, you've got mental pain, you've got physical pain, you know, you've got pain. And it's just knowing and most probably trying to enlighten people on how they can deal with this pain. And through talking, which most probably I would say, like, it's a therapy in its own. And, you know, the more you talk, the more, and I'm not going to say that, you know, you're going to have an illness today and we expect you to talk tomorrow. It takes a long time. I couldn't have a conversation about my mom without crying. But then I've gotten from that phase of that I can cry to the phase of, can I be able to help somebody else? Can I be able to be that shoulder that somebody can lean on? And I'm going to tell you, from my nursing background, the day I'm going to stop crying is the day I'm going to stop being a nurse. So these are stories that everybody's story is different. And as we go on with this journey, and as we continue with these sessions, there are stories that are really definitely going to be touching us. But I thank God, because we have got mental health nurses here who can be able to offer support. And as well, you know, they have continued to enlighten us on where we can be, and sign posters as well on some of these things that we did not know. And I think I'm going to stop there and give somebody else a chance to say something.
Thank you. Thank you so much, Jen. Thank you for sharing with us your personal journey as well as your experience. And as we say, these things can touch all of us. And I think, as I said, cancer has touched nearly every family. I don't think there is anybody who hasn't been touched by cancer in one way or another. And people are experiencing these things, both physically, the physical pain and the emotional pain. And that's why we are here today, because we thought, as Kevin Kararo Leukemia Trust, we thought it's not only signing people, as I said earlier, it is also looking at the other things beyond that, because if we have experienced it, other people must have been experiencing it. And that is why, as I said, and I'll keep on repeating, we formed this space to give that emotional help and to have people share their experiences so that we can help one another. So I'm going now to invite all the members who are here. The floor is open. Please feel courageous enough to share something, and especially a short story of maybe your experience and what kind of skills that you used to cope. Or you can ask, you know, both Jane, me, and Isabel. You can ask a question that we can be able to answer you. So the floor is really open, and welcome, and feel free to ask, feel free to say something. And especially if something has resonated with you in terms of what we have already said, please express it so that we can have that conversation going. Welcome.
Veronica, before we proceed on, I would like to clarify, because I know it's being recorded, that I'm in no way representing the hospital that I work for.
Yeah.
Thank you very much.
Welcome. That's good. So, yes, so is there anything you'd want to add, Isabel, before anyone comes in?
I think it's when you're going through the treatment, for whatever treatment you need, and you need help with some of these applications, it's very important for you to keep all the files of any paperwork that is coming, because that paperwork is what sometimes is evidence needed when you need that additional support. For example, if you're struggling to manage your what we call activities of daily living, you know, the diet, the daily routines, the cleaning your home, and you're having OT assessment, occupational therapist assessment, or you go and see your doctor, oncologist, or whoever you're seeing, your GP, any reports they give to you, they're very important. You know, at home, we don't tend to keep paperwork. Sometimes it's very important to keep a file such that if you need any additional support, you can refer to it. You can use that as correspondence to add on to any applications you're making, because that helps, for example, if you're applying for support, for whoever is making that decision to see how complex your needs are. But if you're just saying things, sometimes you don't know the terminologies. But if there is that with every department, I think within the government, they would obviously be mindful about what medical needs you have, the complexities of it, the severity of it. And if you have that paperwork, it helps you to get help quickly or not. If there is no paperwork, sometimes there's nothing to go by. And I think that's very important.
Thank you. Any question? Thank you, Isabel. Any questions? You can also put your questions in the chat. You can lift up your hand, or you can just unmute and say something. The floor is open. Let's feel free.
Good evening, everyone. I'm Monica, and I have a diagnosis of cancer, which I've completed my treatment recently, and is going through the process of healing, or my body recovering from the treatments and the side effects and things. And it's very, I was introduced to this group by Jane, and I must say, thank you very much, Mrs. Carrara, and for all those who created this group. It's I have experienced your help, and I'm really grateful for it. Much appreciated, and may God bless you all for the great work that you are doing. I must also say that I found it very interesting regarding the things that Isabel was saying, especially when she said you have these forms to fill out and the question that it asks, because recently I've been going through the process of completing some paperwork, which I just think, you know what, let me just leave it and just let time pass, because it's just too much. And the same thing she said about when they ask you to fill the forms and ask you, can you feed yourself? And I'm like, yes, I can feed myself. And I did think, yes, I can feed myself. I can do that, because of course I can physically pick up food and put it in my mouth. But I wasn't thinking that of the whole process of being able to prepare it, going to get it, afford to get it, and all of those things. And I'm thinking, look at this, you know, because I was saying to myself, what's the point in filling this form? If they're going to assess me by this, then it's no point sending it, you know? And like I said, there I go. If I'm the one that gained from this group this evening, then I am, and I appreciate it a whole lot. And yes, how do I go through it? Through this, I was diagnosed last November. And how do I go through it now? I must say, one of my right-hand person is Jane herself. And I'm a Christian, and I've got lots of family support, but I tell you, it's just me living day by day and just trusting God and just trying to not focus on the illness or the diagnosis that I have, but just to think that, you know, I have to live. I've got a 13-year-old son, and I think that I have to live for him. So I put myself aside, and I just take one day at a time and go through it. It's not easy. Sometimes tears come, sometimes the body fail, and even when I feel like I can't make it, he's going to school in the morning, I would get up and I would make sure that, you know, he knows that I'm not well, but I'd make sure that, you know, I get up and see him off to school, and as soon as he's gone, then, you know, I have to give in. And then when I know he's coming again, then I have to try and strengthen him. Sometimes it's just before he comes to the door that I'd probably go into the bathroom and have a shower or something like that, just to put myself together, you know. But I don't know. I suppose taking it one day at a time and going through other issues that exist that life throws at you as well. It's just good to know that a group like this existed, where, you know, you can come, you can hear other people encouragement, what they've been through, and you can share as well what you yourself has experienced. And I just thank God for you and for the work that you're all doing.
Thank you so much, Monica, and thank you so much for sharing. thank you so much, because I know it is very difficult sometimes for people to really express what they're feeling. And we're glad to hear that you have found the session helpful. If you'd want also Isabel to really advise you on those forms, please let Jane know, and we can be able to do that. And what you're saying, what you're doing is right. I know I resonate with you when you say you are having that shower before your son comes in. I always tell people that I never cried before in front of my son. He never saw my tears because I would cry in the bathroom, wash my face, and even put lipstick just not to show him. So I can resonate with that. And I know how it feels. But as you say, taking every day at a time is the best way to cope. So don't think too much away in the future. Just every day you take that minute as it comes. Just focus on the present moment. We have been talking about skills to use, and we've put them on our YouTube. So you can check on some of the sessions we've done before in terms of coping skills, and maybe you can find some tips quite helpful in those YouTube sessions we've had before. Management of pain, and also coping skills, and also resilience and hope. I hope you find them helpful. But thank you again so much for sharing. And as I said, Isabel is here with us, and through Jane, we can be able to support you in those kind of forms. So, because I think Isabel says that language which is not there is not English. How do you say it, Isabel? You can talk to Monica about that, about the language in those forms.
I like to describe life as every area of life has its own language. For the young people, they are speaking a slang right now. If they speak to me, I'm lost. So even when you, for example, who are coming, diaspora people who have to, immigration is a language in itself. If you ask somebody who's not subject to immigration status, subject to immigration conditions, that's a language they cannot understand. If you go to that language of applications and forms, it's a different language. Sometimes it can throw you off. And what they are asking is not what is just literally what you're seeing. So just accepting that this is too difficult. I know I'm not able to feed myself, but what they're asking me sounds like right, but I think I need to check with somebody. The organizations like Citizens Advice Bureau, who can help, Macmillan Cancer can help. There are also lots of other charities, even people like the Irish Forum. There's so many organizations, charitable organizations, wherever you are, that you can tap into, and they help people complete those forms. But I'm more than happy to come along and and support you. You sound like it's great to hear you, Monica, and it would be lovely to see you.
Oh God, I don't know. Thank you so much, Monica. Thank you so much. I just can't tell you. I don't know. I don't know how I'm managing, because Monica is my work colleague as well, and it has been so difficult. I can't tell you. And
You've got each other. You've got each other.
yeah. The thing is, I think as healthcare professionals and seeing your colleague most probably getting the illness that most probably you guys are trying to support people, I think it was very difficult. And working with her through the journey was not easy. And it's you're trying to be there for her, but then you're so in your heart, you're heartbroken. Because we feel as healthcare providers, we're there to support our patients, but then when it happens to us, it is so difficult. And it wasn't easy between watching Monica and knowing that she has got a small child and going through what she was going through. So thank you so much, Monica, for sharing your story. I am so happy for you, and I believe that it is a journey you're starting and of discovering yourself, and you're going to grow old with George. Thank you so much.
Yes, there is a light at the end of the tunnel. That's what we like saying in these sessions. So thank you so much, Monica. We're here. Somebody's is that Eugene? Do you want to?
Yes. So lying down is not a good option.
Huh?
Okay.
Yes. So anybody in the, so thank you so much. I think we interrupted by that child is hungry, Jane. So thank you so much, Monica. We're here. We'll continue to support you. And I repeat, there is a light at the end of the tunnel. So as I said, the floor is open. Let's hear more stories. Mr. Kabake, I know you're with us today. And I'm sure you have a lot to share with the group. Oh, Irene, you have raised your hand, yeah?
Hello, everyone.
Hello.
Yeah, thank you for everything. My daughter Angel has a question.
Okay.
And just to give a brief background to the history, Angel's brother, who is my son, was diagnosed with lymphoma in 2016. So we've been in and out with the treatment and everything, and now he's still with us, but living with a lot of difficulties and disabilities. So the younger sister has a question. Angel.
Angel.
Hi, everyone. My question was just basically, I'm finding it really difficult these past few months to kind of, just with my own mental health, I'm struggling to be happy and to move on with my life. Like a lot of things are happening for me. I graduated, high school, and now I'm going to uni, and I'm feeling like quite guilty in a way because my brother won't be able to do those things, and I'm just finding it like really hard, and I'm not sure how to be there for him, but at the same time for myself as well. Thank you.
Okay. Thank you so much, Angel. First, may I congratulate you for coming in this session, and secondly, for being brave enough to ask that question. I know it's personal, and I know it takes bravery to be able to ask that question. I'll give you Isabel. Isabel, what could you say to Angel?
Angel, I'm really happy to hear that you're here next to your mom. As a family unit, there is nothing as special as a family unit. And just like what we say, if your arm is hurting, your heart cannot be happy. You will feel the pain. Jenny is talking about the pain that you go through, emotional, physical, and everything. So as a family unit, you're one special unit, you're one body. When one of you is hurt, when one of you is in distress, is in pain, is struggling, you will feel the pain. So what you're going through is a natural reaction to what you're going through. It is okay to feel sad. It's okay to feel down. It's okay to feel, I really want my brother to be along with me at uni, and you want to walk those milestones with your loved one. It is okay to feel, that element of feeling, oh, I wish we are doing this together. But on the other hand, I want you to know that you can continue, with going to uni and being successful and still supporting your brother. Going to uni doesn't mean that you've left. You're there for him, and it's okay to ask for help. Your brother is getting his medication and he's taking it. Our emotions, we can feel hurt, we can feel quite down. And when you start going to those feelings of feeling guilty, feeling a bit not enjoying life, it can be a symptom of depression, like we spoke earlier, that when you're going through a very difficult time, that stress becomes sometimes feeling of sadness, anxiety, and it builds up, it becomes depression, and it just continues. So it's great that you're acknowledging and calling those symptoms by their name. And I want to tell you that there is help, and there's support services that are there. Even at uni, there is mental health support services. So I would encourage you to call your GP, ask your GP to refer you to a mental health person. It is talking therapy. If you need sometimes treatment, take it, because our emotions, just like our physical health, can become unwell. And if you acknowledge that I need that help, there's no shame in getting it. You take it, you get better, you talk, and you will get it. The other things I also encourage people to do, like what I was telling, every person, the most rich people, they have their own psychologists. And I always say that every person needs a psychologist in their lives. I have one. I have been to a psychologist to say, and it's within, like Jenny saying, my colleague. So you have colleagues within, you can say, you know what, can I talk to you for 6 sessions because I'm feeling quite overwhelmed? That is talking therapy. And if you're not able to do that, on YouTube, there's so much support, just like the resources, what this is going to be put on YouTube. Someone will look at it and say, oh my God, look at what KKLT are doing about our mental well-being or about how to manage this. So there's some wonderful counselor support out there online, but I would say the first place to go is to go to your GP, talk to your GP, call upon us. There's also support through KKLT, and we will reach out. If you want someone to befriend you at uni, we are happy to befriend you through uni and to say you're not alone. We are proud of you. Well done, and well done for sitting next to your mom and being there for your brother. You're amazing.
Thank you. Thank you very much.
Hi, I'd like to chime in on that one as well. Sorry for baby, she's quite excited. Angel, it's really important for you not to feel guilty that your brother is not going to go through the same thing. But one major thing you can do is go through it with him. So every experience that you're going to go through, don't say, oh, I'm not going to go out today because my brother cannot do it. Call it, if he can on a particular day, take him with you. If it's something to do with your course, ask him for ideas, because those things, the fact that you're involving him in your life, he will be going through uni with you, and you will feel better the fact that you're doing this together. So don't feel guilty that he's not going to go through the same process. And who knows, he might go through that process later on in life with maybe support, and you might be the person to support him through it. So don't say, oh, okay, well, yes, my point here is don't feel guilty. Go through life with him, because he's your brother, you're from the same womb. So you go do life with him, involve him more in your stuff. And don't feel like, oh, I'm not going to tell you that I went out with my friends yesterday because you're going to feel bad. No, he might even be happy for you. He might even say, you know what, wear that red shoe, don't wear that black shoe. You get my point, Angel?
Oh, thank you. That was really helpful.
Yeah.
Thank you. So Angel, I would say, I don't know, I don't have much to add to what the two ladies have told you. All I can say is what you're feeling is true, is normal. Anybody in your position would feel the same way. And as I shared my story, my son was unwell and I was going through, maybe we're all different, so we go through different stuff. So I can remember when I was going through a very difficult time because of my son. And it was difficult, but all I can tell you is that, as we say here, there is a light at the end of the tunnel. So acknowledge those emotions, acknowledge what you're going through. Just know that you're not alone. And I know, as Isabel said, you got your mom and you got your other sister. Talk about your emotions, talk about how you're feeling, acknowledge them, don't run away from them. Because, and we can talk about this even maybe separately from here, because guilt, I tell people, fear, guilt, shame, anger, and sadness are very, very powerful emotions. And if they're not very well managed, sometimes they end up causing us a lot of issues and depression. So I can imagine, and I'm actually very proud of you that you can actually name that one emotion. Most people are not able to mention or label the emotion they're feeling. So for you to be able to label that one emotion, it shows that you're very in touch of what you're feeling, which is a very good start. So stay focused. We could talk more. As I said, we have a few videos that we have put on YouTube about our sessions that we've been having, but you can contact us on the side and we can be able to support you through this journey. Don't feel alone. And thank you so much for sharing. It's very brave of you, and we're here. And as Isabel said, there's also a lot of help out there. So let's get together and we can be able to help you through that journey. Is that okay?
Yes, thank you. Thank you very much.
You're welcome. You're welcome. So we still got a lot of time. So people, we are encouraging people to share. It's good to share. We are, this is a good space. Everything, remember, we are all going through, or we have gone through the same thing. So yes, did you lift up your hand, Mr. Kabaki? I saw your hands up. Unmute yourself.
Hello, everyone.
Hello.
My name is Stephen Kabaki. I live in Milton Keynes, and originally I'm from Limuru, Kenya. In late 2018, I had a few problems that were not, according to me, they were not health problems. But towards the end, you know, I just decided I need this one just because I have this one problem, this other problem, that other problem, and I really don't know how to do, or what they are. So towards the end of 2018, I went to my GP, and eventually I was diagnosed with what they called anaplastic large cell lymphoma. And when I went to the hematologist, they said it's not a very difficult thing to deal with, but it's very aggressive, and they had to deal with it quick. Cut a long story short, I was diagnosed with that, and they said, this is what we are going to do in order to deal with it. And I underwent treatment between February 2019 up until November 2019. The thing I would like to say here is, one, you accept what you have and don't take it as the end of the journey. That is just the beginning of the journey. Because as far as I know, the dealing with the cancer is not the problem, because you don't actually know what it is. But dealing with the problems that it brings is what the problem is. So as you go from the first day that they tell you you have cancer, your reaction, your body reaction, and whatever else that, you know, that becomes apparent as you go is what is important. How you deal with that, I think, is what is most important. When you accept it, and when you say, okay, is it the end? It is not actually the end, it's just the beginning. And I think that is one of the things that helped me through the whole thing. It was, I always tell people, it's the cancer itself is not hard because you don't know it, but the treatment is what gets to you, because that is, I don't know how I can say, but yeah, I think I know how I can say this. It is the effects of the treatment that really, really affect you, but not the cancer. If somebody asked me today, the cancer itself never hurt, but the treatment, so it gets, the treatment to get rid of the cancer is the one that hurt. I've never actually been in real pain, but it was, I think, the most uncomfortable thing that you can ever go through. You don't know what to expect. You don't know what you feel. Sometimes the doctor asks you what happened, or what did you go through, and you cannot be able to explain it. But these are things that we should expect, because we are not, you know, you are not yourself at that time. the way your body reacts to things is not the way your body would react to the treatment, because this is totally what I would say foreign. The body doesn't know it. If I would tell somebody, if somebody came and asked me, "Oh, what would you do if somebody comes and tells you today that you have cancer?" One, accept that you have cancer if that is what you're told and that is the truth. Second, do not give up, because that is not the end. The body has been engineered in a way that it deals with everything until it comes to a time that it has been totally overwhelmed. So accept you have the cancer, accept what that cancer brings to your body, but know your body is going to deal with it as you go. As far as the treatment goes, that is the most difficult thing, because you are subjecting the body to things that it is not used to dealing with. Cells, the body cells, grow themselves. And here you are killing them. So the body doesn't really know exactly how it's going to react. And that is why the treatment becomes that difficult, because the cells keep regenerating, regrowing, rebirthing, and everything else that is involved with the maintenance of the body. I won't go so much into that, but the only thing I'll tell anybody who is going through cancer treatment is know your body, know what it reacts to, and know how to react to those reactions. If your body asks for sugar, do not deny it. You have cancer. Everybody will tell you sugar is going to give you cancer. But if your body asks for for sugar, it means it wants that sugar. So you cannot say, I'm not going to have sugar because sugar gives cancer, and here you have cancer. I'll give an example here. I had my last medication, the last tablet, cancer tablet that I took was on the 3rd of November, 2019. I haven't had any more medication since then. But come 2021, towards the end of 2021, I woke up one morning and the body says it's.
You've gone off. You gone mute.
He's muted himself, yeah.
Hello?
Hello? Yeah.
Can you hear me?
Yeah, we can hear you now.
Yeah, somebody was trying to call. Sorry about that. My body asked for raw sukuma wiki. You wake up in the morning and you feel the thing that you want is raw sukuma wiki. It's not something that you have eaten. You don't even know how the body works out that it wants raw sukuma wiki. But you have to understand that the body knows what it wants. And what I did is, okay, it wants raw sukuma wiki. What do we have in sukuma wiki? You actually even imagine that taste. And at the end of the day, I went to the supermarket and bought all the salads that you can get, everything that is raw vegetables. I bought all that, and I came back home. I blended that, put some honey. You have to make it something that you can be able to swallow. And I had that in the early evening. I woke up about 3 in the morning, and that is all I wanted. So I went back for some more. And after about 4 days, I passed in front of the mirror and I thought, who did I see there? And the body has changed. because that is something that it has wanted. And all I'm trying to say here is, when you go through these things, accept it, understand it, and then know your body. Because your body is building itself. It's being killed somewhere and it wants to build itself. Understand it. You can heal it better than the doctors. But you have to understand it. And for you to come and understand the body and give it what it wants, you have to accept and agree with your body. We are together. Don't give up. I'm with you and you are with me. Don't give up.
Thank you.
And I think that sums up anything and everything I would like to tell somebody who has been diagnosed, everything that I would like to tell somebody who is caring for somebody who has been diagnosed. You know, embrace whatever you have. And then understand your body, feed it what it wants. I will say something else here that probably a lot of people might never even work out. During my chemotherapy, I went through, there is a time that I was supposed to stay in hospital for 3 days, you know, with the chemotherapy. And that time I couldn't keep anything inside. And here I have 9 different medicines, anti-vomit. Anti-vomit medicines, you have 9 different ones, and yet you are vomiting. You can't even keep water inside. And I got to a point where I thought, I mean, what is this? I just wanted to get home and try to see what the problem is here. I came home on the 4th day because that time they had to keep me in hospital because of the vomit. You know, you are vomiting, you cannot go home. And I want to go home so I can work out why I'm vomiting. And then they have 9 different medicines for the vomit. So I came home, and there's a good friend of mine who actually stayed the whole day in hospital with me. And he brought me home about 11 o'clock at night. And I told him, I don't want you to come in. I just want to go and have a bit of a rest. So I came into the house. I slept for like about 3 hours. I woke up at 2:30. I remember that one. I woke up at 2:30. And all I needed was to throw up. And why am I throwing up? I've not even had anything to eat. I've not, you know, it sort of kills you. It is what is inside you that is killing you. And all you can do is, you know, try to work out, why is this happening? Why do I want to throw up? And at the end of the day, I realized that the saliva is so thick. The saliva is so thick. It is actually blocking the whole of the system. It's blocking the lungs, it's blocking the stomach, it's blocking everything, and nothing can go down, only come out. So what did I do? Took a toothbrush, removed the saliva. And then the following day, I went to you know, these days, era of the internet. So I went to the internet, thick saliva, chemotherapy. And it says, chemotherapy reduces the what is this word? It reduces the way the salivary glands work. So they don't produce enough saliva, and when they don't produce enough saliva, it becomes thick, and it, you know, even your digestion becomes a bit compromised. So what I'm trying to say here is, try to get as much information as possible. of whatever situation that you find yourself in. Try to work it out yourself, because a lot of these things, they might make you give up, and there are things you can do in only 2 minutes. You can get the answers in only 2 minutes, but always try to understand your body. I hope I haven't taken too much time of anyone, and if anybody has a question that they would like to ask me, I would be prepared to answer as much as I can, as well as I can, because it's something that I've gone through, and I wouldn't, I would like to use that experience on somebody else so it can make it easier for them to, somebody might be going through the same thing this time and they don't know what it is. I've gone through all that, and if anybody has a question, just feel free to ask. And thank you very much for everyone that is there. Sharing is the best, and it is the first of everything. Thank you so much.
Thank you, Mr. Kabaki. Thank you for sharing your story. Thank you for talking to us and talking to the group. So from what I'm hearing you, it's good to see you are well. And as you describe yourself, you went through a difficult time. And as you said, everybody is an individual. People experience different things, different illnesses. And as you say, I think what I heard from you, the big message you are passing to us is being also your own healer, knowing yourself very well, knowing your body, knowing what works and what does not work. So, because what works for you could not probably work for someone else. So it's really people getting to know themselves very well and their body and how to manage that. And I think we have talked about this in our previous sessions. So thank you so much for that. In terms of food as well, I think we have discussed that about checking the diet when we are unwell. As I said, there are different cancers. They affect us in different ways. And as you say, one of the things also you have mentioned, which I also support you in, is about acceptance. We did talk about that in our previous session. There is nothing powerful than accepting what we have been diagnosed with, the situation, the reality of something. Because sometimes when we deny and put our head under the sand, then it really ends up to being a big more issue and difficult to deal with. And to be honest, we talked about the bereavement process, and especially after you've been diagnosed, sometimes people go through stages before acceptance. So even getting to acceptance is a personal journey. And I can tell you that also from my personal experience. Getting to a point where I accepted that my son is unwell, my son is in hospital, my son has a very serious illness, and things might end up in a certain way. It was a tough journey. So everybody is on their own journey, but if one can consciously accept the reality of things, and as you say, start dealing with the illness, because what happens is that when you don't accept, there is already the pain and the struggle for the illness, but when you don't accept, you add more suffering. That's what we say. Acceptance does not mean, because I think people say, oh, you cannot say that. Acceptance does not mean that you are denying it. I mean, accept does not mean that it's not happening. It just says that it is what it is. This is the reality, and I'm going to deal with it. And the attitude you bring to any illness and to any treatment process, it really helps the body to heal. The mind is very powerful, and that's why we teach mental health. The mind is very powerful. If the mind is compromised, the body is compromised. So when the mind is actually very much alert, very positive, and having the right attitude, the body starts healing very quickly. So, and I can see from what you're saying, and from the talks I've had with you, Bwana Kabaki, it looks like you had that, you accepted that from the onset. And no matter what you went through, difficult as it was, it looks like that helped you a lot. So that positive attitude helps us a lot to cope with. Because I always tell people, if there's no mental health, there is no health at all. Any health is compromised. So here it's very important to mind our mental well-being. What kind of thoughts are we having? What kind of attitude are we bringing to the whole thing? Do we have a negative attitude or a positive attitude? If you have a negative attitude that I'm not going to get better, this is too tough, this is too bad, why me, all these things, that is just going to compromise your body. But if you have this attitude like, I can come out of it, this is doable, I know it is painful, I know it is hard, but I can do it. Which is the best way to do it? What can I get to get me go through this? So we have been talking about that, and that's why we are telling people, you know, if we share this, that we'll be able to go through the journey. So thank you. I was just putting more weight on what you said, actually, Bona Kabake. So thank you so much for sharing your story and what you've gone through. And it's good to see you're strong. I know where you've been. So, and as an evidence of people who are going through the journey, to know there is always a light at the end of the tunnel. And do you know what? Even if there is not that, it depends on that, the light at the end of the tunnel. We always say, sometimes it's also good to surrender, because surrendering to the higher being in terms of he knows what is best. But so long as you're doing your best, so long as you are doing what is necessary, I think that is the most important thing. The other thing probably I would want to add here is giving weight to what you said, that sometimes the treatment is the one, especially the chemotherapy. They say sometimes people don't die because of the cancer itself. They die because of the after effects of the treatment and the infection sometimes people get. And I know those are the things that Jane and Jane would probably be able to educate us on. So I'll also stop there, and maybe I'm also talking too much. Yeah, and leave the floor open.
Can I say something there? Thanks so much. There's something about chemotherapy that we probably would not be able to understand, but I try to think about it and try to gauge it as somebody who has gone through it. Like I said just before there, the body has been engineered in a way that it always rebuilds itself. It will always look for a way of, taking care of whatever problems come to undo the engineering that has been done, if I can be able to say that. And the worst thing about chemotherapy, or when you are undergoing chemotherapy, is you never feel the same thing twice, because the body will look for different ways of dealing with those things. Chemotherapy is only for a short time. And this is what I'd like to, because people actually give up on chemotherapy because it's that uncomfortable. But that discomfort only happens within a very short time, not more than 24 hours. No, actually, I cannot say that I ever suffered for more than, maybe I think the maximum was like about 6-7 hours. But if you give up on chemotherapy, you give up on everything. Because we have to give the body the chance, and we also have to give the doctors the chance. If the doctors think this is what is best for you, embrace that. If you think this is what best for you, embrace that together with what the doctors are giving you. Do not give up on chemotherapy. Do not say it is painful. Do not say it's uncomfortable. Do not say anything about it. Just take it as there's something here that I always say about bad things or things that you don't think are very good. You know, the sacrament, everybody takes it, nobody says what it tastes like or anything like that. But your chemotherapy, if somebody has decided this is the best treatment for you, embrace that one and deal with it to the end. do not give up in the middle.
Okay, so
Thank
let's,
you very much.
Thank you.
Gathoni Moigai, thank you so much for having taken care of me. I haven't seen you in a long time.
It's good to hear that your testimony, Mr. Kabaki. We've walked that journey. I never knew you, just like Jane said, she didn't know Veronica, but I knew you through our Kenyan community here, and we've become friends. And I've seen the testimony and what you've gone through, and I salute your courage in speaking out. God bless you.
Thank you so much.
Jane, is there anything you'd want to add? And also anybody before we close?
Jane, me?
Yeah.
Yeah. Thank you very much, Mr. Kabaki. I hope you can remember, I definitely can remember me as well, because we came to see you with Veronica.
I've been trying to see. I thought I've seen this person, but I don't know where.
Yeah. So whatever you've been, I mean, the treatment is a very personal journey as well. And, you know, with chemotherapy, and when it comes to chemotherapy and diet, and, you know, when you said about whether the body wants sugar and you have to eat sugar, you know, we see all sorts of things. In my life as a nurse, I've seen so many patients who have come and said they have been advised not to eat sugar, not to drink sugar, not to do this. And all we tell people as healthcare providers is that you need to eat a well-balanced diet. And you need to tailor your diet to how you're feeling. If you're on chemotherapy and you feel, I hate the smell of meat, then definitely you're not going to be eating meat. With the treatments that we have at the moment in the 21st century, they are very well tailored. Antiemetics are fabulous. You know, the days of people vomiting and being sick all over because of chemotherapy, I think are almost gone. You know, and treatment is tailored to your personal needs as well. It's tailored to your body weight, it's tailored to your disease. So, you know, it's a very complex process. And when you say it about, you know, if you're given chemotherapy, take it. In the profession that we're in, you see people who come and say, I want to go onto the side of alternative treatment. And it saddens our heart, because we know if alternative medication could be able to treat cancer, then those people would be very rich people. They would, if they discovered the treatment of cancer. And I would echo your words. If you go to a healthcare provider, if you go to a doctor or consultant and they tailor your treatment and they say this is what you're going to have, it is good most probably, and it's the best advice that they can be giving you for a cure. The other thing as well, I would say, is that people need to learn their disease. People need to know what they have. If you went and they told you about anaplastic lymphoma, you need to know, this is the disease that I have, this is the question that I need to ask. And if you know, it's a very confusing time. If you know you're going to see a consultant and you cannot be able to, and this is so overwhelming, take a friend. Call anyone. I mean, even call any of us. I mean, I'm happy to go if I have the time. But, call somebody to go and take notes. Ask the doctor, can I be able to record the conversation we're having? Most of the consultants are going to agree to this, so that at least when you go home, you can listen to what he was trying to explain to you. If you don't understand, ask. And I think the problem that I've seen within our community is that people go, they are just like, yes, doctor, yes, doctor, yes, doctor, because we come from a background of doctor is always right. But you need to question the doctor. You need to read. You need to look at the research that is out there. You need to know what your disease entails for you to be able to educate yourself and to be able to ask the relevant questions. And I think I'm going to stop there as well because of time.
Thank you. Thank you, Jane, for that. We really needed that from you because you are in it. You know what happens. Information is power, knowledge is power, so we need that for all our holistic health. So I want to thank everybody who have been. If there's anybody, I don't want to close before, giving anybody who is there a chance to say something. So please, before we close, if you have something to say, please do it, and then we're going to close in a short time.
Can I say something more, please, while I am just on my way driving?
Yes.
My name is Susan.
Mhm.
I feel like I wish I was there just to share with you. But unfortunately, I should say, I am going to work and I wasn't able to maybe join you. But let me tell you, since from when you started, I've been with you, I'm listening, and I'm so encouraged. So I just want to say, let's move on because it is the way forward. Encouraging one another is the healing, where the healing comes to. Where there is stress, you talk, you share like this, we get support. And so let me just thank you all, and looking forward to joining you one of these days so that we can share together. And God bless you. Have a good evening.
Thank you so much, Susan. Did you say Susan? Yeah.
Susan from Reading.
Thank
From
you.
Reading, yeah.
Thank you so much, Susan.
I know
Thank
if
you.
I start talking, I will be distracting everyone here. So let me just have a moment when I'm just somewhere seated so that we can share together.
Oh, lovely.
God bless you.
Lovely. So next time we'll be looking forward to hear from you, Susan. And thank you for joining us. We really appreciate. And thank you for your positive comments. We need that to encourage us to keep going on.
Yeah, thank you.
Thank you. Anybody else who have something to say before we close? Anybody?
Thank you all for coming, and thank you, Veronica, for inviting us to share with you. You're doing a fantastic job. And just to say that our mental well-being, if you said that if there's no mental health, there's no health. And mental health is just your emotions. There's no need to label it like a big name. And if you can call the emotion what you're feeling and now start talking about it, you find that you feel better. When people are going through the treatment, it can also be very overwhelming. Sometimes you need someone to vent. We call it ventilate. You just want to talk and say how you're feeling and to be heard. So just don't be afraid to pick up a call and just let someone listen. Let someone sit with you and just vent. Just say it. Let someone sit there with you, hold your hand and say, I'm here, I hear you. And that way you feel that you've released all the stress and the pressure and that you can give yourself a chance to heal and kind of just like you're just putting away all that negative emotion and then starting all over again. Give yourself a chance to vent, and we are here to listen.
Thank you, Isabel. That is well said. God says a problem shared is a problem halved. So I've had that one. I use that one with my clients because I know once you share, you feel relieved and you're not holding that weight on yourself and on your shoulder on your own. And remember, there is nothing new in the world. There is nothing you are experiencing that has not been experienced before. Because I don't understand why we want to hide these things. Well, actually, people have been experiencing things, even more difficult things than you. So it's always good to share so that you can be able to, to get that help, to feel relieved, to have new ideas, to expand your thoughts. Because sometimes when you are so stressed, you only see as in a tunnel vision kind of a way. You're only seeing your pain, your issues, your problem. But it's when you share and you hear from somebody else, actually your eyes opens up and you can see this side and you can see the other side. And sometimes you can feel relieved because I'm not the only one who is going through this. I'm not the first one who've gone through this. And there are solutions out there. So there are so many outlets when we talk, but when we keep things within ourselves, it's like a pressure cooker. When you just cover and something is boiling and boiling and boiling, it's going to burst. And what we need to do is to relieve, open that cover. And once you open that cover, the steam is going to spread, and there's not going to be any, there won't be any bursting. So let's share, let's keep sharing. Let's keep helping one another. And as I said, we are here to help you. We are here to support. We are here to share. We are here to offer a shoulder to cry on. And let's keep up the good work, all of us. So I want to thank you again so much for attending this session. I feel also encouraged, and I'm sure you have felt encouraged. So shall I say, we have come to the end of the session. I'm wishing everyone a good evening, and we meet next week. We meet every Thursday from 7 to 8:30, and we have different topics, but I think what we need to do is to have these interactive conversations more and more, and let us bring our issues and our experiences together so that we can keep on encouraging each other. So thank you so much again, and may God bless you all. And Monica, I do wish you all the best, and everyone else. Angel, we are going to be talking, and yeah, so I could go on and on as well. So have a lovely, lovely, lovely evening. And I want to also say special thanks to Isabel and Jen for coming in and sharing their expertise and experience with us, because we need our personal experience and we need professional experience at the same time. And they're so, so, so valuable. So thank you so much, everyone, for being here with us.
Thank you.
Thank
Monica,
you.
Thank you.
Veronica.
Thank you and
Veronica.
good night.
Veronica.
Yeah.
Before you close, anyone who has got any questions, or anyone who would be most probably is having something that they're going through, and with their disease, or with a friend, or they want some information, I'm happy to provide any information. And even if I don't have it, I can be able to get it. I can try to find ways of getting it. So and it's from the right channel.
Yeah.
And if you think that most probably you've been told something has gotten to an end, I can as well try and find some trials that are going on that most probably can enroll, and those kind of things. Even if I cannot be able to facilitate, but at least I can give you the knowledge so that at least you can be able to provide to your consultant or doctor. Thank you. Good night. Yeah.